Good morning. Let's learn about the anti-cancer drugs. First is L-asparaginase. So it's given by the IV route. Mechanism of action of L-asparaginase is that it's going to break down asparagine. This asparagine is actually the source of lymphocytes. When you block that, you're blocking the source to lymphocytes. So thereby, lymphocytes cannot synthesize asparagine and its selective lymphocyte toxicity. That's the reason it is used in cases of ALL. What are the side effects because of asparaginase? It's going to decrease insulin synthesis and causes hyperglycemia. It's going to decrease lipoproteins and causes hyperlipidemia, decrease coagulation factors and leads to hemorrhage, decrease anticoagulation factors and thereby leads to hypercoagulation and also hypersensitivity reactions. Now let's learn about retinoic acid. This retinoic acid is a drug of choice for PML, promyelocytic leukemia. If the patient is unresponsive to retinoic acid, you can change the drug to arsenic trioxide. What is the side effect of retinoic acid? Is it's going to cause pulmonary syndrome. What is the mechanism of action of retinoic acid? It acts as a differentiating agent at supraphysiological levels. It's going to cause differentiation of the cells. The next is proteasome inhibitors, which is bortezomib and carfilzomib, which is used in cases of multiple myeloma. Very, very important. So proteasome inhibitors, bortezomib and carfilzomib. The side effects of proteasome inhibitors include thrombocytopenia and peripheral neuropathy. And the drugs for multiple myeloma, this is very important actually. Bortezomib, lenalidomide, dexamethasone, and daratumumab. It's actually a monoclonal antibody. So this is all about the drugs for multiple myeloma. This regimen is very important. Bortezomib, lenalidomide, dexamethasone, and daratumumab. Let's learn about the monoclonal antibodies acting with tyrosine kinase inhibitors. First is EGFR, which is epithelial growth factor receptor, which is otherwise known as HER1. So this receptor is actually blocked by cetuximab and panitumumab, which is used in cases of head and neck cancer and in colorectal cancer. This particular page is very important. Proteasome inhibitors is bortezomib and carfilzomib, multiple myeloma. Side effects you have to remember. The drugs for multiple myeloma regimen is very important. Bortezomib, lenalidomide, dexamethasone, and daratumumab. Monoclonal antibodies acting with tyrosine kinase inhibitors, EGFR, which is otherwise known as HER1. This receptor is blocked by cetuximab and panitumumab. The next is EGFR tyrosine kinase inhibitors, which is gefitinib and erlotinib, which is used in cases of non-small cell lung cancer. HER2 receptor, we all know, is actually used in cases of breast cancer. So it is actually blocked by trastuzumab, which is a main site, and it is also blocked by pertuzumab. HER2 tyrosine kinase is blocked by lapatinib and neratinib. So we all know VEGFR, which is vascular endothelial growth factor receptor. VEGF is blocked by bevacizumab, ranibizumab, and aflibercept, which is used in cases of macular degeneration, whereas VEGF receptor is blocked by ramucirumab, which is actually used in cases of GIT cancer. It is ramucirumab, RAMUCIRUMAB. VEGF receptor tyrosine kinase inhibitor is vandetanib, which is used in cases of medullary thyroid cancer. Axitinib and sunitinib is used in cases of renal cell cancer. Sorafenib is a drug of choice for hepatocellular carcinoma. Livatinib is used in renal cell carcinoma and hepatocellular carcinoma. So first is vandetanib. Just remember Vande. So vandetanib is used in cases of medullary thyroid cancer. Axitinib and sunitinib is easy, which is used in cases of RCC. Sorafenib is the drug of choice for HCC. Livatinib is used in RCC and HCC, which is renal and hepatocellular carcinoma. The next is CD20 blocker, which is rituximab, which is used in cases of chronic lymphocytic leukemia, non-Hodgkin's lymphoma, and rheumatoid arthritis. Ofatumumab is used in cases of CLL and in multiple sclerosis. CD20 blocker is very important. MCQ asked it many times. Rituximab is CD20 blocker, which is used in cases of CLL, non-Hodgkin's lymphoma, and rheumatoid arthritis, whereas ofatumumab is used in cases of CNL and multiple sclerosis. Let's learn about the various immune checkpoint inhibitors. The first is PD-1 inhibitors. And what are the various PD-1 inhibitors? So first is nivolumab, dostarlimab, semiplimab, and pembrolizumab. You have to be very careful with these names. Sometimes they might confuse as well. So let's learn about the various checkpoint inhibitors. The first is nivolumab, dostarlimab, semiplimab, and pembrolizumab, which is going to block PD-1. Okay, so these are used in lung cancer, uterine cancer, bladder cancer, Hodgkin's lymphoma. That's it. Okay, so let's learn about the specific uses of pembrolizumab. pembrolizumab and the nivolumab, which is used in breast cancer. Okay? And the next is ipilimumab. Ipilimumab is CTLA4 inhibitor, which is which has got the same uses as nivolumab, dostarlimab, cemiplimab, pembrolizumab. These are all PD-1 blockers, which is used in cases of lung cancer, uterine cancer, bladder cancer, Hodgkin's lymphoma. Pembrolizumab, very, very important. In breast cancer, we use pembrolizumab. Okay? So lung cancer, uterine cancer, bladder cancer, which is same use as these drugs, PD-1 blocker, CTLA4 blocker, which is ipilimumab. We have PD-Gal1 blocker, which is durvalumab, avelumab, and atezolizumab. The next is gluten tyrosine kinase inhibitors, ibrutinib, acalabrutinib, which is used in cases of B cell lymphomas, and example is CLL, mantle cell lymphoma, marginal zone lymphoma, and the Waldenstrom's macroglobulinemia. These are all B cell derivatives. From the B cell, these tumors arise. So these are all used in B cell carcinomas like CLL, mantle cell lymphoma, marginal zone lymphoma, and the Waldenstrom's macroglobulinemia. The name of the drug is ibrutinib and acalabrutinib. Let's learn about the MAP kinase inhibitors. So what you have to remember is this the pathway, and this is the pathway, but it's okay if you just remember the drug's name. BRAF inhibitors is vemurafenib, dabrafenib, encorafenib, whereas MEK1 and 2 inhibitors, tramitinib, selumetinib, binimetinib. This is the pathway for melanocyte proliferation. Just remember, inhibitors are very, very important. Vemurafenib, dabrafenib, encorafenib, MEK1 and 2 inhibitors, tramitinib, selumetinib, binimetinib.